Hello, everyone. Thank you so much for joining our webinar for Mexico Cosmetic Center. Um, I'm going to be starting pretty soon. I am waiting for everyone to join. I still see people joining. Um, so we've been doing this pretty much every other month. We go live and we talk about plastic procedures we offer with Mexico Cosmetic Center in hospitals are in Tijuana. Um, Today I have several people joining me. Flora, she's the head of the program um, coordination. Dr. Peter Lopez, he's one of our top plastic surgeons, board certified, and Dr. Raquel, she would join us and talk about stem cell that we've been doing in our center. In order to be evaluated, we need you to have a health questionnaire in our system, which is you go to mexicocosmeticcenter.com and you fill out a health questionnaire. I would release a Zoom poll at one time toward the end of the program, the presentation, and please go ahead, take some few minutes to do that. And basically, two things I need to mention here. One is because of our program has been so successful, even though we use 3 or 4 plastic surgeons at this moment, but we are getting full really fast. And remember, our surgeons don't do so many surgeries in a day. So we are limited about the spots that you guys are interested. So I would recommend highly to act fast to get the date that you like if it's your schedule. And when you actually get on the calendar, please help us by completing your paperwork, your payment, all that we need, your files be complete at least 30 days ahead. That gives us enough time to make uh, arrangement for you in the hotel, in hospital. Let's say if you select to stay the night before when you arrive in the hospital, if you come by yourself, or you want to stay in the hospital all the time during your recovery, we have option to do that a lot more when you do this ahead of time. So that's what I'm recommending for you guys to do. Again, welcome everyone to our webinar for Mexico Cosmetic Center. I will have Dr. Peter Lopez to join me in maybe 20 minutes. He has some surgeries today, of course, and we are trying to catch him in between. We try to cover as many questions that we feel everyone is asking, and if you didn't hear it, we'll go at the end and try to answer questions. So put your questions, if you didn't hear, be covered during the presentation in the Q&A tab. Just a little bit about myself and Flora. I started medical tourism in Mexico in 2007. And I started Mexico Bariatric Center and Mexico Cosmetic Center in 2012 and 13. And I worked on a project which is Hospital Ozar. It started in 21, and this is one of the major hospitals right now in Mexico, in Tijuana. And we started operating in 24. So you go into a brand new state of the art with a great patient experience and advanced equipment. Um, so just we have a great team from here, US to Mexico. Um, Right now, we're working, Flora is leading the coordination, which is Tiffany, Lisa. Occasionally, we have Kelly to help us. And in hospital, Azar has given us the opportunity to offer a lot of different procedures and a lot of different services that we weren't able to do before. So you're getting benefit of this, of course. We do skincare, of course, with Dr. Raquel, Botox, filler. We started our new regenerative medicine, which is basically to alleviate pain, is for pain management, improving diseases like Parkinson's disease, diabetes, and of course, joint problems like knee, back, shoulder, spine. And we do this for anti-aging wellness. So there's a wide range of services that we do with stem cell, including pre-op package that would help you recover better and faster. That Dr. Raquel is going to cover at the end. Again, we do gynecology. Sometimes we can offer some plastic procedures or bariatric procedures with gynecology, like hysterectomy, for example. We call them hybrid procedures. So, and today we're going to cover these subjects, right? So we will talk about MCC, hospital Azar, how to get on the calendar, where to start, and how get approved, and what procedure to get. Dr. Lopez is going to cover all the procedures that we offer, most of them that we can offer during this presentation. Basically, post-bariatric weight loss, skin removal. That's just the main subject. We would talk about our all-inclusive packages, which sets the standard in the industry. Dr. Raquel will talk about stem cell, and we will run the Zoom poll, and we would try to answer all your questions. Okay, just give me one moment. Okay, so um, one of the issues or worries that patients have, especially female patient, is about loose skin after massive weight loss. And first of all, not everyone is going to get loose skin. We'll cover what were the criteria. And there's no worries because, first of all, after bariatric surgery and weight loss, you're going to feel like you're 16 or 20 years old again, and you get the energy back. And then basically, skin removal is going to help you feel tight and look like, again, renew yourself and be back like when you were young. So there is no worries. And that's what MCC does. We have a criteria of selecting post-bariatric patients. One of them is the BMI. We want your BMI to be low. This is very important. Some centers don't pay attention to the BMI. We are very strict about that. We want your BMI to be less than 30. And if you're not, please make sure by the time you come down to Mexico, your BMI is less than 30 because it helps tremendously on your success, the complexity of your surgeries, and also we want you to wait 1.5 years out uh, from your weight loss surgery, because that gives you time to reach your ideal weight, your goal weight, and there is no more fluctuation in your weight. So you get this transformation once and you get it done. You don't have to repeat it. There is no revision. Again, these are the procedures that we offer. Of course, Dr. Lopez is going to cover more detail. But again, the age, the race, the genetics, how fast you lose weight, if you take protein, if you exercise during your recovery, helps a lot with your loose skin. So not everyone needs a skin removal, but if you do, we're here, no problem. One thing that we are very careful and we are very strict about is the number of hours that you are under anesthetic, okay? There are centers that then don't pay attention to this. They keep patients under for 8, 9 hours. We're definitely watching for that, and that's we try to do as many procedures in one operation to keep the hours less than 5 or 6 for your well-being. Okay, so after that, when the surgery becomes prolonged, the surgeon is tired, is fatigued, their team is hungry, they're tired. The anesthetic itself makes you possibility of higher infection rates, harder recovery, hard recovery for your wounds, so many cardiovascular problems, respiratory problem, blood clots. So it's just is a bad idea to have prolonged hours in the OR. And these are the things that you need to pay attention. And when you go with us, we are monitoring all the factors, and it's like we are protecting you in so many different ways. When you go by yourself, you don't know what you're going to get. So that's our role. Our role as a coordinator company facilitator is to make sure your travel is successful, your surgery is successful, peace of mind. You don't have to guess which hotel do I stay, who's going to pick me up, how do I get to the hospital, how do I get to the hotel. We make different arrangements for your convenience and to fit your situation, whether you bring a companion or not. We do all that coordination for you. And CDC recommends for patients going across the border to go with a facilitator like us. And who's better than us? We have so many years in the industry, and we have top surgeons, we have top hospital. Everything is set up for you for your success. Now, one of the top benefits of getting this procedure in Tijuana, in Mexico in general, but Tijuana, is that, first of all, not very many surgeons in US willing or capable of doing multiple procedures in one operation. We talked about that. So the challenge is to do as many procedures in one operation without jeopardizing your well-being. And this is what we do. Our surgeons are at a different level. Their skill set, their experience is off the chart. And because they're not doing marketing or they're not getting on the one-on-one consultation, this and that, they are dedicated in the OR doing surgery every day. Every single day, they are in the OR practicing their skills, okay? And not only they're board certified, they are experienced in handling post-bariatric patients. That's huge because not every surgeon can handle the type of patients who have gone through massive weight loss. This is the one thing you need to pay attention. And of course, we offer all-inclusive packages I mentioned. We do all the arrangement for you. You don't have to worry about a thing. All you have to do is to drive or fly to San Diego, and everything is on us. One thing I always mention is about power of social media. Social media is a great tool, is a great in our, at least in our lifetime. TikTok, Facebook, Instagram. But one thing you have to be careful is a cute TikTok or a Photoshop picture of before after shouldn't be the reason you select a company or select a surgeon. You need to look at their credentials, how much experience they have. Is the organization is trusted? Who's behind it? Is it just they hire some, you can hire with, actually a lot of the people right now are getting these remote jobs that all they do is post the stuff on the social media for these companies, but is a lot of it is just advertising. But what is real? What is the reality? Who is the surgeon? Where is the hospital? Who is doing all this coordination for you? Is it a reputable, trusted company like MCC, or they're just a one-man show that all they do is pay someone, I don't know, $1,000 to put pictures on social media? We are a US-based corporation. Actually, I am joining from our Sacramento office. That's where our headquarters are. And we are a corporation in California. We've been dedicated to quality of the service, of the procedures, hook up with the best surgeons, select those surgeons that are expert in what our patients' needs are. In a way, MCC, like MBC, sets a standard in the industry. We regulate what is the standard of treating patients, taking them down there, giving them surgery, and bringing them back. Our process is very simple. Like I mentioned, you guys need to put a health questionnaire, and I will go over how the picture is the best way to get it in a minute. And then our team, which is experienced handling this type of patients, they're going to connect with the surgeon, consult for you to see what's the best option for you. They come back and we give you a recommendation. That recommendation sets up a price. Again, is everyone is different. It's how much skin we have to remove. What is involved in getting you back to when you were young. So that, and at that point, all you have to do is pay the deposit, start doing your paperwork. I mentioned, please do your paperwork ahead of time to get the options you need. And then you're ready to submit your flight or your drive, however you get there, and finish your paperwork. For face, these are the best views to put in your health questionnaire. If you're doing a facelift, this is how you need to post it in the health questionnaire. Okay. And okay, so and when you're doing the mommy makeover, actually, this is a good video. Let's watch it. Let's see if I can get it. Let's see, get out of this one. It's like I got stuck there. Okay. Yeah, let me. Okay. So basically, that's just the way to best pictures to get for best consultation. Um, One thing I want to mention, when you get on the calendar a month ahead of time at least, do a blood test to check your hemoglobin because especially patients who have had bypass and sleeve and DS, you need to make sure your hemoglobin is over 12, 13. If you don't, then you have time to bring it up. By the time you get to down there, you have the right. The more procedures you want to get done, the higher the hemoglobin needs to be. Now, this is the process of handling your health questionnaires, okay? When you submit your health questionnaire, it goes through our patient coordinator team, our surgeon liaison, and we connect you with the best surgeon for you. For example, not all plastic surgeons are good with face and not all good with body contouring. So we know which one is expert in what area, and we connect you with that surgeon. Unless you have a preference, we connect you with the best option for you. We have a support group before and after you can join and learn what it's like to go through the surgery. We have few thousand members, and you can trade, your experience, your before after pictures, and these are real patients. Say too young, I don't know things about it. 16th of September, lying in my bed, I'll report. It's never too late, couple thousand miles, it takes the little speed, so. So hospitals has been a game changer for us, for our patients. Um, you have the best of the best. This is a hospital. The name came after my mother, and was a tribute to her. The safety standards, the advanced state-of-the-art surgical suites, our recovery rooms, and the hospital itself, it's just out of this world. It's becoming one of the major hospitals, mostly one of the most respected hospitals in Mexico. And there are 4 ORs, 6 to 7 recovery beds, 40 hospital beds. We have everything in-house from X-ray to lab, and these are not Photoshop pictures. These are real. Every patient has a view of outside with glass windows, and most of our rooms are single bed. We do have some doubles, but again, because we have limited number of double, if you need that, we're coming with your friend, buddy, whatever, so you need to act fast. For companions can stay with the patient or they can stay in our hotel. Either way, whatever it comforts you, and you can come and visit if you stay in the hotel, of course. Medications, if you're on Ozempic, we want you to stop at least 2 to 3 weeks before. No blood thinners, NSAIDs 1 week before. We would tell you if you're taking a medication on a regular basis, which one to stop and how to start, when to start. And if you're taking something on a regular basis, just bring the bottle with you into Mexico. We want you to arrive before noon. And sometimes, now we're going to go over the stem cell. If you're getting a stem cell treatment, maybe come 2 days before. We want you to have your departure time arranged 2 p.m. The day that you leave, we want you to, whatever, if you're flying specially, your flight should be around 2 o'clock. That's optimal time. When you arrive, the day you arrive, you have option to stay in the hospital or hotel. A companion can stay either with you or in the hotel. On the day of surgery, if you're in the hospital, no problem. We take you, get you prepared for OR. If you are in the hotel, we pick you up, we bring you to the hospital. By the way, hospital, Azar and Hyatt are about maybe 3 blocks away. It's very easy to go back and forth. Now, one thing again that sets us apart is the hospital. This is a fully certified, COFEPRIS certified hospital. We don't, for now, we're keeping almost every plastic patient 2 nights in the hospital and give them option to stay longer. But we're not a surgery center to do the surgery and try to let you go the same day or keep you only 1 night. So the package right now, that's again, take advantage of this opportunity because it may change. We're keeping all plastic patients 2 nights as a standard in the hospital. Each package is customized for the type of surgeries you get, and it can be total of 7 nights, or each actually could be more. But we tell you what day to arrive, what day to go back home. And again, these are all inclusive in the package. For Big Mommy Makeover, for example, we keep patients, first night you come, hotel or hospital, 2 nights hospital, and then sometimes 5 nights post-op. So this is a 8-night package. We don't tell you to go get your own hospital reservation, do this, do that. Everything is tailored around your procedure. Again, MBC is one of the top providers of bariatrics, and these are the procedures that we offer. Laparoscopic, endoscopic, we can do anything in this area. We added the gynecology, like I mentioned, hysterectomy, endometriosis. We have the top surgeons in the world that we work with that they do endometriosis diagnosis by mapping, MRI mapping, and we do endometriosis procedure. Whether it's laparoscopic or open, we have added orthopedic, which can do anything from knee replacement, hip replacement. And here I have Dr. Lopez. Let me see if he has joined us actually. Let's see if he's here. How to look for him. Okay, I am going to see. Okay, so like I mentioned, Dr. Peter is has a surgery today, and we are trying to catch him in between. So not seeing him yet. Panelist, okay, so panelist, okay. Yeah, he's not here. So let me introduce him, and hopefully he will join shortly. Again, our plastic surgeons are not only board certified plastic surgeons, which is a requirement for working in a hospital in Mexico. Otherwise, you won't be able to. Maybe in a surgery center they can work, but not in a hospital because we check their board certification. They are also post-bariatric specialists. If you haven't worked with a post-bariatric patient, their skin, their veins, everything is different in these patients. And you need to have experience, extensive experience to know how to do these extensive procedures. Remember, we're doing multiple procedures in one operation, which means most of the time is tummy tuck, breast lift, maybe tummy tuck arm lift. And we do butterfly, um, circular plus breast lift. These are huge procedures. And again, we keep all the procedures under 5 to 6 hours under anesthetic. So it's huge benefit to you for your safety and well-being. So actually, Dr. Peter Lopez is from Guadalajara, which is Guadalajara is the top medical center in Mexico. All the best surgeons are coming from Mexico City, Guadalajara, Monterrey. So we are attracting top talent from all over Mexico. We're not just limited to Tijuana. I'm going to list the type of procedures we offer for cosmetic since we're waiting for him. Um, so we do facelift, and facelift could be a simple. Um, okay, he's typing. Okay, he says he's here. Oh, there you go. Okay, so I'm going to let him come in. Oh, come on. Okay, there you go. Okay, so Dr. Peter, you are on mute and your camera is off.
Okay. Hello, everyone. Can you hear me?
We still don't see you though.
Okay,
All
perfect.
right,
Right
perfect.
now I'm in this. Okay, can you hear me right now?
I hear
Can you
you,
see me?
but I haven't seen your picture yet. It looks like you have enabled,
Yes.
but it's black for some reason. Oh, there you go. Hello, hi,
Yes. Hello.
how are you doing?
How
Nice.
are you? Hi, okay, perfect. Hello, everyone. My name is Dr. Peter Lopez. I'm a board certified plastic surgeon based in Tijuana, Mexico. Thank you for being here today. I'm really excited to share with you not only what I do, but how I approach my patients and their results. Okay, I currently operate an hospital Azar. For me, it's very important that patients feel safe and comfortable, not only during the surgery, but throughout their entire experience, especially because many of them travel from the United States. I'm a certified by the Mexican Board of Plastic, Aesthetic, and Reconstructive Surgery. I've been practicing it for over 5 years and have performed more than 3,000 procedures. But more than numbers, what really defines my practice is focusing on safety, patient selection, and a natural result. Okay, we are talking about the procedures that we can perform at Hospital Azar. In my practice, I perform a wide range of procedures from facial surgery to body contouring. But I mainly focus on body procedures, especially tummy tucks, mummy makeovers, post-bariatric patients. We tend to be more complex and require more planning. Okay, let's start talking about facelift. Can you help me run to show the next slide, please? Oh, thank you. Perfect. Okay, let's talk about the facelift. Uh, when I perform a facelift, I'm not just focusing on the skin. I focus on deeper structure like the ESMAS layer to achieve results that looks natural and lasts longer. For me, the goal is always the same: to make the patients look refreshed, not different. So we have to know that we offer two kind of facelift, the traditional and the plain facelift. What are the difference between that kind of facelift? Well, first, the traditional, it's the ideal candidates are the patients who can or want to improve the eyes, cheeks, and the forehead, but the patients who wants to improve the jawline, the cheeks, and the neck, that's mean the lower half of the face, the deep plane face are the ideal procedure for them. So that's the difference between this kind of procedure. The duration of this surgery is maybe an average 6 hours. You have to stay at hospital one night because we need to take care of you one night in order to evaluate you the next day. And the recovery, you may be gonna have 4 to 6 months of recovery. That means that your healing process gonna last that maybe that month. Okay, the next please. Okay, this is a illustration that explain the what I tell you before. Um, and what I always tell my patient is, we are not trying to change who you are. We're trying to restore a better version of you. So in these cases, the isthmus layer it's a layer that we can make a procedure really deep from this mobile ESMAS layer in order to reach these procedures and have mm, better results. So that's the difference between when you can see the yellow line. So that's the difference between the traditional and the deep plane facelift. So when we perform a deep plane, we try to cross the yellow line. So you can notice that we can use the mobile ES mass and also the platysma that it's a muscle of the neck. Okay, there are results that our patient have, and you can notice that we're trying to restore a better version of them. So it's the same patient, but it look happier. So that's the target of this procedure. Yeah, she got a deep plane facelift. Okay, about the rhinoplastic. In rhinoplastic, I focus on both functions and aesthetic. Not all patients are candidates for a closed rhinoplasty, and not all patients are candidates for a open rhinoplasty. So you can see that we offer these kinds of procedures, but also we need to evaluate you in order to decide what is better for you. In my practice, I often prefer the open approach because it allows me to see everything clearly and work in a more controlled and comprehensive way. At the end, the goal is always harmony with the face and natural result. How you can see in the picture. About this kind of surgery, the duration of this surgery is an average 2 hours. You have to stay at the hospital one night, and the recovery is 2 or 3 months. It depends of your healing process. Okay, the next, please. Okay, you can see this this change of my patient. You can see how we can change the symmetry. We can make the difference between the projection and proportion. So you can see the difference between the upper pictures and the lower pictures. So that's the target of the rhinoplasty, to make a natural shape and recover the structure in order to have better results and natural results. Okay, the tummy tuck. Tummy tuck is one of the most important procedures in my practice. There are many types, like mini, full, extended, circumferential, fleur de lis, and not every patient is a candidate for all of them. One of the most important things I always explain in my technique depends on the patient, not the other way around. Especially in post-bariatric patients, we often need more advanced approaches to really achieve a good result. That means that in the post-bariatric patient, we're gonna need fleur de lis, circumferential tummy tuck, or a combination of these procedures. So we can perform a fleur de lis with a circumferential tummy tuck. About the procedure, we always try to cut the excess skin and fat, and also we can perform a liposuction in order to improve the results. Obviously, we need to have a good level of hemoglobin in order to make this surgery. So what we can improve with tummy tuck? Well, we can improve the muscle because the patient always has a separation of the muscle. It's called like diastasis of rectus, and we try to make an internal corset in order to reparate and try to suture together this muscle, and we can recover the shape of the abdomen. Also, we try to remove all this excess skin because when you lose weight, you have excess of skin. So we remove all of this skin and we can get a flat abdomen. The skin is closed with drains to remove fluids, and the incision is stitched up. You gonna have these drains maybe 7 days in order to make sure that you don't have fluid inside of it. Okay, these cases show how we can we can combine procedures to improve results. But something very important is that not everything should be done at once. Sometimes doing surgery in a stage give safer and better outcomes. So that's a good thing to know. So the first patient that you see on your left, she got a fleur de lis tummy tuck. So that's why she got a scar in the middle line. So you can see how she improved the laterals and also the lower back of her abdomen and her abdomen. About the tummy tuck and breast lift, that a combined procedure. We're gonna talk about this kind of procedure in after. It's called like tummy tuck, but well, let's continue about the tummy tuck. The healing. One thing I always talk about this with my patient is obviously the healing. Results don't depend only on the surgeon. They also depend on the patient, their skin, their habits, and how well they follow the instruction. So you have to know that you can improve and try to um, to heal your scar. Silly contains cream for a scar up to 12 weeks. That can be useful. Protect it from the sun and use sunscreen are also a thing that you can do. Avoid strenuous activity for at least 6 and maybe 8 weeks. It's also a recommendation that I always give you. Avoid submerging and stretching incision. Also, it's a thing that you're gonna have to hit. And you have to stay hydrated and eat healthy diet and proteins in order to have a good healing. So remember, the results don't depend only on the surgeon; it depends on you. That's why we also talk with our patients to have this follow up. They have to keep all these instructions in order to have good results because post-bariatric patients are really special. We really love the post-bariatric patient because they are really they try to follow all these instructions. That's why we also try to take care of them. Okay, perfect. In breast surgery, I always start by asking the patient, what is your goal? Do you want more volume, less volume, or better shape? Because every case is different and the plan has to be personalized. So that's why when I perform a breath lift, I explain to my patient that we need to make a incision, but there are many kind of incision like you can see in the pictures. The first one it's lollipop, The second one is the anchor or inverted teeth, the donut or periareolar, and the crescent. Obviously, this gonna depend of the shape of the patient and the goals of the patient. Also, the quality of the skin. Many patients, I mean the post-bariatric patients, gonna need the anchor or inverted T breath lift incision. So it's not really bad to have this kind of incision. No, it's really good because it can live in a better way the breast, and you're gonna have a last result. So we can offer these procedures also the liposuction, the breast implants, because if you don't want, for example, if you don't want to use a breast implant, we can use your own fat. So we need to perform a liposuction maybe in one or two areas in order to harvest all of this fat and try to put in your book in order to improve the volume. But you have to know that it's an option if you don't want breast implants. About this procedure, we can see the difference between the breast of this patient. You can see how it lifted, and also this patient wants a breast implant, so that's why she looks natural round form. So that's the thing, and also she got a T inverted or anchored incision. So this incision is gonna be hide under the breast and also the periareolar area. So maybe you're gonna see just the vertical incision. So that's a good thing to know about this kind of incision. Okay, let's talk about the arm lifts. The arm lifts are very common in patients who have lost weight. I always explain that we can improve the contour, but the scars are part of the trade-off. Being honest about that helps with trust, and also the patients really likes the results. So we need to know that the arm lift that we do at the hospital are two types. For example, the mini arm lift are a small incision in the underarm area. Excess skin and pockets of fat are removed. These procedures is for patients that maybe are not post-bariatric patient, that patient that just want to improve the axillary area. So that's a mini arm lift. The standard arm lift are for post-bariatric patient because the incision is upper arm and remove the excess skin, then tighten and smooth excess. So it comes from the elbow to the axillary area. About the extended arm lift are incisions that we can extend to the lateral breast area. So that's a thing that you have to know, the difference between these procedures. You can see this post-bariatric patient. This is the picture of on your left are 2 months after her surgery, and the next picture is 4 months after her surgery with the same patient. So you can see that she also tried to improve her activity, and she tried to exercise, and you can see how improved the shape, and also the scar. You can see that it's come from the elbow to the axillary area. That's a standard arm. So that's a good result. She is really, really happy.
The
I can see
question.
you, Flora.
Oh, hi, can you hear me?
Yeah, I can hear you and I can
Okay.
see you.
I do have one question for you regarding the arm. And
Yeah.
so sometimes you would, when someone has a extremely extra skin, you would not be able to remove all the skin at the first time. Is that true? Because
Okay, yeah. You mean that if we can perform two stage of arm lift?
Yes, yes.
Yes, yes. Why? Because many patients have excess of the skin in special areas like the elbow to the hand, and this area is really special, and you have to take care of them. And maybe if we perform in all of this, you're not gonna be able to move in a good way, or maybe you're gonna have a good feeling because maybe you're not gonna be in that position all the time. You need to
You
flex
would.
your elbow. That's why in some cases we try to separate into a stage this kind of surgery. It's the same of extended arm lift because you can be all the time in that position. You need to lift your arms, and maybe if you maybe lift a box or you drive, you can be in that position. That's why we try to perform this kind of in these special cases uh, into a stage the arm lift.
Okay. That's and then how long do they need to wait? Like 3 months or 6 months for the second, like a revision?
Okay, okay. We have to wait maybe 4 months in order to have a complete healing.
Okay.
Actually, that's a lot of the questions I see. Angela, Raymond are asking if they have to separate the surgeries into two stages like that, how long it is. So 4 months is a good amount of time to wait from the first to the second surgery.
Yeah, yeah,
Okay.
perfect. Okay, so let's talk about the tight lift. Tight lift procedures are also very common after weight loss. This is a secondary procedure because many patients wants to start with the abdomen area and the breast area. So we call a secondary a stage procedure. So this procedure, again, the approach depends on how much skin laxity the patient has. Like this patient that you can see, we can perform regular extended and spiral tightly. Also, it's gonna depend on the skin laxity. So we offer this kind of procedure, and you can get at the hospital with us. So can you, yeah, thank you. You can see the change of the texture of the skin in this patient. She got a regular tight lip, so the incision are hidden in the medial area of the leg, so you can see the incision. But that's the point of the surgery, that we can hide the incision. Okay, let's talk about the mommy makeover. Mommy makeover is one of the most requested procedures. But I always tell my patient, just because we can combine procedures doesn't mean that we should. Safely, always come first, and sometimes staging is the best option. Um, and what is a mommy makeover, doctor? Well, a mommy makeover, it's a combined procedures. That means that we can combine a tummy tuck with a breast lift, a breast reduction, a breast augmentation, and also we can add a lift, a thigh lift, or a liposuction. So we can perform three procedures in one stage. But again, I try to emphasize that we need to have good level of proteins and hemoglobin to have this kind of procedures. A mommy makeover. A mommy makeover, in short word, is a mix of three procedures in one stage. This procedure, you are gonna need to stay 2 nights at the hospital because we need to take care of you because you know, there are 3 procedures in one stage. And about the recovery, it's more than the last the past procedure, because you're gonna need maybe 3 months in order to have a complete healing. Okay, can we see the next, please? Okay. Um, she is the left patient is a patient that got 3 procedures. The procedure that she got was breast lift with implants, liposuction, and a tummy tuck, a circumferential tummy tuck. So you see that she got 3 procedures in one stage. That is called a mummy makeover. But obviously, she had a good level of hemoglobin, a good level of protein. So she had a good level, a good result. So after that, we can see in 4 months after her procedure how the shape changed and how confidence is her at the beach. So we can see the change of her body. So
Looks
that's the
amazing.
point. Yeah, yeah. She is a young patient that has the the history of pregnancy. So she got the skin, a flat skin and a shiny skin. So she told me, doctor, I need to improve this abdomen. So what do you propose me? And I propose her
In the last certain.
mommy makeover. So we performed a breast lift. You can see the shape of her breast in the bikini, and also we can see the flat abdomen that she got. Obviously, she tried to exercise too much, so we can see how improved the shape of her body. The next patient
Mm.
also got tummy tuck, a liposuction, and breast augmentation. You can see that this patient uh, is not is not overweight, but she wants to improve the shape of her body, and we perform a standard tummy tuck with her.
Very nice.
Perfect. About the BBL. For BBL, the result depends on how much fat the patient has available. Why? Because many patients that doesn't have a good fat wants to get a round, a big shape of her BBL, but I always try to explain to my patients, if you are a post-bariatric patient, you have to keep in mind that your problem, that your issue is the skin, is not the fat. So that's why I try to explain them that with a BBL, we're gonna improve the shape. And if you exercise, it's gonna be easier to see the change of your BBL. So that's also explain this procedure. Not all patients are candidates, and sometimes expectation needs to be adjusted. Obviously, safety is always my priority in order to explain this kind of procedure. We need to perform a liposuction in order to remove fat from the donor area. And the extract fat is purified and injected into the buttocks. So that's the point of the Brazilian butt lift. Also, this is a procedure that it can perform just by alone. I mean that it's not a procedure that we can perform just in a stage. We need to perform with a tummy tuck, with a liposuction, with a mummy makeover, because it's a complementary procedure. Right now, we are seeing the how we can change the shape of the body. For example, I explained that we combine procedure with a BBL. For example, in the patient of your right, you can see that we perform a circumferential tummy tuck. and also a liposuction in order to add the fat in her buttocks. But also the cut, the circumferential tummy tuck, let us to lift the butt. That's why the BBL are a combined procedure. About the left side, you can see how we can improve the hip dips of this patient, and we can get a round natural shape of her butt.
Okay,
Okay,
great. Well, yeah, this is a part that we're gonna get Dr. Raquel in, because you have to go back to the operating room. I want to ask all the questions, and then we get Raquel to join. Um, so couple of questions that is coming up.
perfect.
Like you mentioned, Mummy Makeover is basically a combo procedure operation, which can include any of the tummy tuck, breast lift, arm lift, thigh lift. But do you recommend, for example, arm lift with thigh lift or tummy tuck with thigh lift? Do you recommend that?
Okay, I try to recommend my patient to don't have two extremities include. That means that you can add an arm lift and a thigh lift in the same stage. We need to separate the extremities. That means that you can have a tummy tuck, bread lift, and an arm lift, or a tummy tuck, bread lift, and a thigh lift. Why? Because you don't gonna have a good recovery. You're not gonna move. So the one important thing of the post-surgical stage is to move in order to prevent thrombosis and risk of complication. That's why we need to separate the extremities. So that's the point of the combo of mommy makeover.
Yeah, because several people ask about this. So yeah,
Yeah.
so it's not recommended to do arm lift with thigh lift.
Yes, it makes sense.
And let me see. There was another question. Sabrina is asking that she weighs about 230 pounds and she's a 5 feet 4 inches, and she's considered plus size. Do you recommend a plus size tummy tuck for her?
Okay, about that, it's important to know about the BMI. The BMI is a measure that let us to know if a patient is a good candidate to get this kind of cosmetic surgery. And BMI is a combination of her weight and height. So if you get a number that it's 30 or maybe more than this number, you're not a candidate to get this procedure. So you have to be below the 30, maybe 99, 98, 97. But the ideal BMI, you have to be below 30.
Okay. Another question is, can abdominal etching be done with tummy tuck and lipo with other procedure? Abdominal etching.
Okay. About this, she means that about the belly or about the muscle repair.
I'm not sure actually what she talked about.
Because I really don't understand the point of that
Yes.
question.
Okay. Maybe you
Because
can.
yes, I can explain about the tummy tuck and the liposuction when they are together. The tummy tuck, how I said before, the tummy tuck led us to repair the muscle, the separation of the muscle. I mean, the diastasis of the rectus. It can let us to make a internal corset in order to improve the shape, and also the liposuction can let us to improve the areas, specific areas in their body. So I don't know if this is a answer of this question. Another question that the patient also has for the belly. The belly is the same. We use the same belly. We just try to hold down the flap and try to make a new hole in order to place her or him own belly. So I don't know if it's all about that the question.
Now, one other question they're asking is very interesting. Is tummy tuck going to help with the thigh lift?
Yeah.
Okay, a combination of
No,
tummy tuck with.
when you do a circular tummy tuck, doesn't that also pull
Okay, yeah,
lift the lower body, right?
Just a little.
yeah, yeah. Yeah, actually, a circumferential tummy tuck can lead to improve, like the picture that you can see right now, improve the shape of the butt. Also, in the front area, we can improve the thighs.
Mhm.
So that's why I always recommended the thigh lift like a secondary procedure, because you're gonna see a change with the tummy tuck, and maybe um, it's not gonna be able to perform the thigh lift after this procedure. So you have to keep in mind that circumferential tummy tuck can improve the butt area and the thigh area.
Yes.
Deanna is asking, I'm getting a circular fleur de lis and a breast lift. Will I have incisions around the breast and all the way around my lower abdomen? I'm okay with that. I just want to know what's going to happen to me.
Okay, so about the tummy tuck, the circumferential tummy tuck with fleur de lis, the patient who has candidate for this procedure are patients that have sagging skin on this area, on the lateral, thorax lateral, and the upper area of her back. There are the ideal patients. Why? Because with the floor release, we can try to put this together and improve this area. Okay? And also about the circumferential, it can be, it's going to help the boot area and the thigh area. About the breast lift, I don't know if she wants just a circular incision. I don't know if that's a question about the breast, a periareolar scar. I don't know if that's the point of about the
You
breast.
know, so do they get scar around their breast when they do a lift?
Yeah.
Yeah, the
Yes.
Okay, let me see what other ones that
Okay.
I need to ask you before we can Okay, so that's a good one.
Yeah.
Sam is asking, I'm a male. I would like to get a tummy tuck and a lipo 360. Does that include my ab sculpting?
okay. So I want to ask him if he's a post-bariatric patient or not.
Is he a bariatric patient? That's what
Oh, I don't know.
ask.
Sam, can you
Okay,
tell us if you're a post-bariatric
why
patient?
this is important? Because when we perform a tummy tuck and a liposuction in post-bariatric patient, we can touch the central area because we can kill the flap. We call in that way the incision that we perform can let us to touch the central area. So the liposuction can be performed in this area. Why? Because this area receives the nutrition of all of this abdomen. So maybe you're gonna have a two-stage surgery. That means that you're gonna can have first the tummy tuck with the liposuction, and after that, if you want to get abs, you need to have a liposuction alone, because we can perform that, because in the second stage we're not gonna make incision in your abdomen, where because when we make incision with the abdomen, we can make a liposuction in a central area because it's like we are killing the abdomen.
That's a good question, and that's a very good answer. Thank you.
Welcome.
Does tummy tuck affect the vagina area in any way?
No.
No.
Oh, we lost your picture, Dr. Peter.
Okay. Okay. About the last question, what was the question? Sorry,
If
I
they
can.
did, if they do tummy tuck, does that help? Does that change vagina?
Yes, actually, the Mons area improve with the tummy tuck because it gets flatter, so you can improve the Mons area mainly. No, the vagina, the Mons area, because the vagina it's another procedure. It's a vaginoplasty, so it's different. But if you mean that the Mons area change with the tummy tuck, yes, the answer is yes.
It
Uh,
changed the outside, not the inside. That's what you're saying, doctor, correct?
Yeah, inside because you get
Not
a
the
flat
inside, the
area.
outside.
Yeah,
so
yeah.
Sam is the one asked for tummy tuck and lipo 360. Sam, he says yes. I had gastric sleeve in 2024.
Yes. Yeah, so he gonna need two-stage procedure because we need to perform first the tummy tuck with the liposuction, and after that, 360 liposuction in order to get abs. Because in one procedure it can be possible.
So they're asking the same question. They're saying the Mons area gets pulled up when you do tummy tuck, and you can
Yes,
see more of the lips.
yes. The answer is yes. We can improve and we can get a flat mount area.
So another question they're asking, can you do hernia repair during tummy tuck? I don't
About the
know.
hernia. Okay, this is a interesting question because it's gonna depend of the hernia. Because if it's a belly one, in the umbilicus area, it can be done. But if it's in another area of the abdomen, it can be possible, but because it's considered a dirty surgery, and we can make a contamination inside of the abdomen. So we can combine intestinal and another kind of elements of your abdomen to repair a hernia. So just if it's a umbilicus hernia.
Tanisha is asking, I would like a mommy makeover with no BBL. I have vein hard to access.
Okay, yes, it is when we perform a tummy tuck, we always ask for our patient about that if they want to look more natural and use their own tissues. We don't perform a BBL, so we can perform a circumferential tummy tuck, a liposuction without BBL, of the procedure that she wants, but it's not a rule to have always a BBL with a tummy tuck or a liposuction.
Okay, so the rest is pretty much what I need to answer. Um, so basically, this is an all-inclusive package, and you don't need to bring your own dressing or things like that. We cover all that you need. Even if you stay in the hotel, our nurse is going to come and change your bandage and things like that. And then As far as garment, if you need a garment for your type of surgery, it is covered in the package. As far as the hospital, in 24, we opened Hospital Azar, and that's where we're doing all our operations, bariatric and plastic. Now, do they go home with drains, or we remove drains before they go home?
It depends of the days that you stay at Mexico, because I try always recommend it to our patients to stay at least 7 days. That doesn't mean that you have to be at the hospital. Maybe at the hotel you can be the rest of the week. But I really like to recommend that. But if you want to leave the Mexico before that date, you're gonna get to remove at the United States the drugs, because we can remove them before 7 days. Why? Because you're gonna get fluid inside of you, and you can get open wounds because of the water that is inside of you.
Patients always want to do all that they need in one surgery, one trip, but again, we keep everything under the 5-6 hours of operation, and then
Yes.
we pay attention, like the things that Dr. Peter mentioned. Do the arm lift with breast lift, for example, tummy tuck, and come back for a thigh lift. This is a really, recovery is a huge part of this uh, plastic surgery, okay? So you have to take care of your wounds good, use tapes, for example, to make sure. And Dr. Raquel in a minute is going to cover what we offer. We offer hyperbaric chamber. We highly recommend, especially for mommy makeover patients, to use hyperbaric chamber. They can do several sessions before they leave. Lymphatic massage, and newly added stem cell that we're going to cover in a minute. And so, yes, these are a huge part of the recovery. Take care of your incisions. We tell you exactly what to do. There are those silicone tapes that we should probably apply 3 months even after. It makes the incision flat. It makes it heal better, looks much better with taking care of it.
And doctor, you recommend to use the tape a month after the surgery, correct?
Yeah, if the incisions are really dry, you can use it. And
No.
also, Ron said something important. The chamber is really, really important to have it your sessions. At least 3 sessions after your surgery, you have to take the session. So I really recommend it to have the chamber therapy.
And remember, each patient is different. Your age, your skin, how much skin you need to remove, whether it's face, body. That's why we custom every patient to what their needs are, the number of days you need to stay there. Everything is customized to your needs. So these are great questions, but at the end of the day, once you submit your application, we deal with you. We do the best to offer the best for you. And also remember, I mentioned that the recommendation that we make, the surgeon make, and our coordinators make here doesn't mean that's what you're going to get. When the surgeon actually meet with you, they mark you, that's the final plan, and you agree. We, like patient asks, do I get BBL? You don't have to. So when you get down there, you have another consultation with our surgeon that exactly determine what is it that you're going to get. and that's only determined at the time of the consultation with the marking in the hospital. Now, Tracy is asking, should I work out and lift weight before the surgery?
Yes, you can exercise before the surgery. A thing that I don't recommend you is to use the this kind of substance in order to increase the energy to perform or to exercise. Okay, try to avoid that kind of powder and things like that that try to improve the energy. Why? Because if you want a surgery and you use this substance, you can get too much waste of blood in your surgery. But it's really nice to exercise before the surgery. After, before and after.
But not the right after, almost a month after.
Yes. You have
Yes,
to wait 2 months, 2 months in
yes.
order to have a good full exercise.
Now, Miva is asking, I had sleeve with 3.5 years ago, had my makeover last year with MCC. Well, she had MBC, MCC. She said, my experience was awesome. I'm very happy. The care I received, I'm considering facelift now. And she's asking, how long after facelift before you can see the final results in your face?
Okay, the healing process, the edema, maybe can last 2 or 3 months. So you're gonna be the result after the third month, on average.
3 months.
So 3 months, but Tanisha is asking for, again, we cannot give you any price. We can tell you what the starting price is, but again, every patient is different.
Yeah.
Once you submit your pictures, your health questionnaire, we understand what is, specifically your situation. We do recommendation. The price also is determined after that because that depends on the number of nights you stay in Mexico, at what extent we have to remove the skin, right? Because if you're not a massive weight loss patient, you may just need minor, maybe just a standard tummy tuck. You're not a circular fleur de lis.
They could
So I think Dr. Peter, thank you very much for attending. I know
Welcome.
you have surgery. We're done with all the questions that was asked related to you. So if you want to jump off that,
Okay,
yeah,
thank you, and it's really nice to be talk with you, with all of you that are right now watching this webinar. Greetings and have a good day. Thank you,
Thank you,
Ron. Thank you,
doctor.
Flora. Thank you,
Thank you. You
everyone.
have a wonderful day.
thank you.
Yeah, thank you.
Bye.
Yeah.
Bye-bye.
Yeah. Okay, let's get to regenerative medicine, specifically pre-op stem cell package for better recovery. Okay, we talked about hyperbaric chamber. Now let's see if I can find Dr. Raquel here. Okay. There you go.
Hello.
Hi.
Hi.
Let me see if I can promote you to panelist. Sometimes it takes several attempts. Okay. I think okay, perfect. So
Oh,
yeah, how are you?
and hello everybody. I'm good. How are you?
Great, great.
Hello, doctor.
Hello.
How are you?
I'm good. Thank you.
Awesome.
Okay, so you want to tell us about the exciting new program we have for stem cell regenerative medicine?
Yes. So, first of all, I'm Dr. Raquel Martin. I am the new aesthetic and regenerative doctor here in Hospital Azada with MCC and MBC. We have new treatments now that are stem cells, specifically mesenchymal stem cells, that these treatments are going to help our patients to reduce inflammation, promote healing, and overall wellness. These mesenchymal cells, we obtain them from donor cells. There's a lab here in Tijuana where we get them either from bone marrow or also from umbilical cord. And these have the potential to promote themselves to differentiate to any type of other cell that is needed. It boosts the body for natural repair, reduces inflammation. It reduces also fibrosis, scarring. It optimizes tissue health, accelerates operative recovery, and overall surgical outcomes. It also helps as an anti-aging in aesthetic medicine. We can use them on hair, face, skin, specifically for like patients who are having plastic surgery. Very beneficial prior to the surgery so that their recovery is a lot easier and they can mediate inflammation and help with recovery. For patients who are bariatric, who are going to have either the gastric sleeve, bypass, wherever the procedure it is, it's going also to help with healing. And if you have underlying conditions, whether it's diabetes, high blood pressure, patients who have autoimmune diseases, or joint pain, these treatments with stem cells are going to help with recovery, and it will target those areas of the illness and help manage it. So if you have like lupus, if you have an autoimmune disease, it will mediate the inflammation and help with it. So the benefits of stem cell therapy before surgery are going to be, one of them, faster healing. It reduces inflammation, supports cellular repair, and strengthens body regenerative response. Also, it improving the take-in fat grafting. So it helps the relocated fat, especially this is when we're talking about patients who have plastic surgery. So it will relocate the established blood supply and leading for more lasting results. It also reduces downtime, which means it'll be faster healing, less bruising or less time of bruising, and quicker, so you can go to your activities a lot faster. And aesthetic skin glow, it improves texture and elasticity because it promotes also collagen. So just also something that's very important, patients who have cancer are not eligible or that have had cancer before 6 years. So if you do not have any underlying history of cancer or no previous history with family with cancer, you are a candidate. But if you have a history of cancer and are interested in these procedures, there's a lot of tests that we need to do first. So keep in mind that, because these procedures are very fast, we can do them that same day. It lasts for about an hour, maybe an hour and a half, depending. However, if you do have history of cancer, there's more tests to be done. So just keep in mind that you might need to stay another day just so that we have those tests ready beforehand.
Perfect. Yeah, so this is really exciting, especially for plastic patients, because the package that we're offering for pre-op is going to immensely, well, first of all, if you have any issues with your knee, because it's um, done through the IV, it's going to help you with so many. But basically, you're going to refresh your body and also help you recover because, you know, the tummy tuck, breast lift, those are extensive procedures. The hyperbaric chamber, stem cell, uh, lymphatic massage, all is going to help you heal much better. Thank you so much, Dr. Raquel.
Thank you so much.
I had one question for you here. Let me
Yes.
see. Um, Yeah, so actually Raquel is asking, I'm already, so if you are already on the calendar, you can ask your coordinator, Tiffany, Lisa, Flora, to add this package for you. The pre-op stem cell package is not a problem. Um, Two questions. Tracy is asking if I had, what about skin cancer?
Okay. So with skin cancer, it's the same thing. We just need to do the markers. We need to do previous cancer markers to make sure that you don't have anything that's active at the moment, to say that yes, we can apply these stem cells, because since stem cells, what they do, their action is to proliferate and make more cells. Patients who have cancer and have cancer cells, these cells are going to be directly going to the cancer and gonna make it worse. So that's why patients with cancer are not eligible.
Now, one question, can we just use the exosomes and not the stem cell if they have some similar situation with cancer?
Yes, exosomes, we can use them without a problem.
Yeah, so patients like that who have skin cancer or some kind of cancer, we could just do exosome, which is greatly, again, going to help with your cells and your recovery. Yes. Now, fibromyalgia, if they have, does the stem cell help with fibromyalgia?
It does help with fibromyalgia, because fibromyalgia is an autoimmune disease, and it will help with mediating inflammation, because with fibromyalgia, what happens is that your body's attacking itself everywhere. And that's why they feel pain. That's why they have all of these kinds of symptoms. So with the stem cells, it will target the areas that we need and mediate the autoimmune response.
Well, again, this is a huge part of our services and offerings that we're doing in stem cell, because the MSC stem cells is very advanced and it's COFEPRIS certified. COFEPRIS is like a FDA of Mexico, and it offers so many benefits from, like I mentioned, from wellness, anti-aging to what, you know, the pain management in the knee, in shoulder, in spine, and also diseases like we mentioned. And we are taking advantage of that for our patients who are going through extensive procedure like mommy makeover to help them recover faster. We offering is to bariatric and plastic patients, which is, I think, is revolutionary what we're doing, and it's very advanced. Again, thank you so much,
I have
Dr.
one
Raquel.
question, Dr. Raquel.
Yes.
So you mentioned if you have a family history that they had cancer, you recommended also the patient checked, see if they have to do some kind of test, correct?
Yes, especially with colon, prostate, breast, and ovarian cancer. These 4 cancers, since they're very inherited or have a lot of like family history involved in them, it's very important that you have negative markers for that cancer. And we have the test here in Tijuana. However, they take around 24 hours. So that's why with patients who have that kind of history, underlying history, it's better if you arrive 1 day prior, so that you have 24 hours for the test. We apply the stem cells, and then the next day you can have your surgery.
Okay, perfect. Thank you.
Now, before I proceed, yeah, so if you have I know you have patient at 12 o'clock, so
Thank you.
you're free to leave whenever you. Thank you so much for
Thank you,
your time.
everybody. See you soon.
Yes, we see you down there. So one thing I wanted to mention about the so yeah, so basically these are the skincare. Well, this is something Dr. Lopez was supposed to cover, and I'm covering it. Basically, you need to take care of your scars, not lift heavy weight, and be patient. Don't do extensive exercise, going to the gym, lifting weight, and you have to wait quite a bit until everything is healed well. And then, of course, walking, being active is great, but nothing extensive, okay? And this is a schedule for different procedures. So we are recommending 3 months to 6 months. This is the spa, floor spa at the hospital there that we do Botox and things like that, filler, skincare. These are our all-inclusive packages. As you see, you get all into one package. You don't have to worry about it. Something I wanted to mention that I forgot was we offer this unique service of medical tourism insurance. This is a $199 that it will cover you for so many different complications, and it covers you 45 days out. Now, we talk about, why MCC and the difference between experienced surgeon and an assistant surgeon that hasn't done much surgeries, especially for post-bariatric patients. This is our medical tourism insurance, MTI. And these are the options if you need financing. So we are, usually we have Kelly jump on the call with us. Kelly came to us first looking for plastic surgery, lipo to lose weight, but we told her this is not the right choice. And she went through MBC, got bariatric surgery, then she came back to MCC and got plastic surgery. As a matter of fact, she's one of our affiliates that work with us. And these are patients who have done pretty much we call total transformation, which means they have gone with us, had surgery, lost weight, they came back and did plastics to finalize their transformation. And as you see, you look like you're young with 20 years ago. As you see, Josh, we have so many success stories that patients change their lives. And, they just, so you can see us on social media, mexicocosmeticcenter.com. We are here anytime you need. Thank you so much for attending this. I did not release the Zoom poll. I'm going to do it anyway, a little late. But if you get a chance, please answer these questions for us. Appreciate you. Thank you so much. Have a great day.